If you're just joining us, I was just talking about that I did a radio show this morning in Atlanta, um, and it was on a station called 1026, and it was at 8:30 this morning, and you can find it online at 1026 The Situation. And it was an hour interview, and we talked a little bit about COVID long hauler. So um, what I'm going to talk about today is I'm going to talk about the symptoms of COVID long hauler, or the most common symptoms. The most common symptoms are number one, according to the CDC, WHO, and some studies that are being done, are the pulmonary symptoms. And it's not just one symptom. Some people may have like a lingering cough or a mild cough, and that cough may come and go. Other people that had like serious lung damage from COVID can have things like shortness of breath when they're exerting themselves, shortness of breath at rest. I've talked to one lady that had problems breathing at rest, and she was on oxygen, and her lungs were affected like she had COPD or emphysema. And she told me that the treatments that they were trying to give her, or that they were giving her, weren't really improving her symptoms much at all. So a lot of damage can happen with the lungs in COVID. And those symptoms can become chronic. And they're currently testing different medications that they use in like emphysema, that they use in asthma, to see if those help at all. Some people are still requiring oxygen at home. Hello, Journey of May and Me, welcome. So we're talking about some of the symptoms of COVID long hauler. And so I started by talking about the lungs and some of those symptoms. And so some people may have a chronic cough or an on and off cough. Some people may have shortness of breath. Some people may have challenges at rest or with exertion with their lungs. So those are some of the common symptoms. And it can look like asthma, it can look like emphysema. And the treatments they are trying to, to see in studies if some of these treatments will work, but they're using things that they use for asthma, they're using things that they use for emphysema, they're using things that they use like when people are in the ICU, when they have lung inflammation, to try to get the inflammation down in the lung to see if that will help. So let's see, second in line for the symptoms, I'm going to say brain fog. So brain fog is really common. And this is similar to what we see in some other chronic medical issues. For example, I've helped a lot of veterans that have Gulf War illness, and they have brain fog. I would say that it's a manifestation of systemic inflammation. So usually people have inflammation throughout the body when they have brain fog, or it could just be inflammation in the brain, but often it is inflammation throughout the body. And this is a symptom that can linger, and they're not sure why people with COVID long hauler have it, but we know from like people with Gulf War illness, people with chronic Lyme, people with HIV, people with Epstein-Barr virus, which is a virus that causes a lot of thyroid problems. It causes, you may have heard of it as kissing disease in college students. So that's a chronic virus. CMV is another chronic virus. Herpes, there are several types of different herpes viruses, chickenpox viruses that can be chronic. So when viruses get in the body, often they'll stay in the body, and they'll often stay in the nervous system. And they'll crop up every now and then when a person's defenses kind of drop, like if they get tired or stressed, then the symptoms may pop up again. So brain fog is one of the main symptoms that people are complaining about. And there's no one treatment for brain fog, but we're going to talk about things that can be done on the following days when we're doing this challenge. So stay tuned, come back tomorrow. We're going to keep talking tomorrow about, we're working our way towards addressing the different issues that come up with the COVID long hauler. So I was talking about brain fog because that's one of the main symptoms. And about 30% of people that get COVID will have chronic symptoms, or at least that's what the CDC and WHO so far have seen with the numbers. And it seems that the numbers are not dropping with Omicron. I've heard mixed reports from overseas about Omicron. But before Omicron, they said that the severity of the COVID episode has nothing to do with the persistence and the severity of the symptoms of the lingering or the long hauler COVID. So you cannot predict by the severity if someone is going to have long hauler COVID. Although we know when people are in the ICU and seriously critically ill, like if they're near death, they usually, regardless of whether it's COVID, whether it's a heart attack, whether it's a stroke, people, when they're forced to stay in the bed for a couple of days and when they're on breathing machines, they get long-term or short-term symptoms such as these as well. So the next symptom that I'll talk about is widespread body pain, like fibromyalgia. So a lot of COVID long haulers will have joint aches and pains, arthritic aches and pains, as well as fibromyalgia. And fibromyalgia is a specific diagnosis where people have diffuse pain in the muscles. And there are criteria for evaluating it and making the diagnosis. That specific doctors are more experienced with it. I would say that physical medicine and rehab is one area, which is one of my background areas where people are more experienced with it. So, hi IFM. I'm not sure who joined from IFM, but thank you for joining. So I'm working my way through some of the top symptoms of COVID long hauler. Hi. And so we talked about some of the lung symptoms. We talked about brain fog. We talked about fibromyalgia, joint pains, like arthritic symptoms. And I think I'll top it off with headaches, because that's one of the more common symptoms that may linger. Some people will have on and off headaches. Some people, the headache never resolves completely. It may go down in severity. Oh, thanks, IFM. They're making some comments. It may go down in severity, but some people won't have headaches. So some people have intermittent headaches. So it's a common symptom, and it's in the top symptoms that people complain about. And I would say that it kind of goes with the fibromyalgia, in that we've seen these symptoms in people that have chronic inflammatory diseases, like I mentioned, chronic Lyme, Another one is chronic mold or chronic mold exposure, where they have a high level of toxin. And I mentioned some of the viruses that can hang around chronically and cause some of these symptoms as well. So the last symptom that I'll talk about is chronic fatigue, and we're almost done. We started a little bit late, but I'm going to finish up here. So chronic fatigue is really, really common. Chronic fatigue or fatigue symptoms is common in the American population as a baseline anyways, because it has to do with the quality of our food, our water is not where it should be. We have a lot of toxins and toxicants in our food and water and air. And so we're constantly exposed, and we have a high level of toxicity. And our mitochondria, which are inside the cells and help us to make energy, a lot of times are kind of a little, I wouldn't say lazy, but kind of lagging in function. And that will make us feel fatigued. We also have a high level of insulin resistance in the United States because of our food supply and because of the foods that people are eating that are highly processed. But the COVID virus behaves sort of similarly to some of the other viruses that I mentioned, like Epstein-Barr virus is one that can cause fatigue. And they're not exactly sure of all the mechanisms, but they can affect the mitochondria. And so people can have fatigue, and they may try a number of different treatments, but they really need a functional medicine or an integrative medicine approach. We have a systematic approach. We're looking for certain root causes, and that can be confirmed with like testing. And we're looking for correcting the things that we know can contribute to chronic fatigue and these other symptoms that I mentioned, so that the person can get some recovery and help. Often people with these symptoms like fibromyalgia, chronic fatigue, headache, often they have mineral deficiencies. There's often vitamin deficiencies. There's often low levels of antioxidants. So we'll get into how we approach it in the next couple days. And if anyone has questions, you can go ahead and post your questions. I've got a few people on Zoom too. And I am going to, let's see, I'm gonna unmute the people that are on Zoom. I think I'm gonna unmute, let's see. Okay, I think what I did is I'm allowing you to unmute yourself because it looked like I had it blocked. So if you want to speak, you can just unmute yourself. Okay, and anyone that's on Instagram, you can also unmute or not unmute yourself, but you can write in the chat if you have a comment or a question. All right, well, the objective is to have like these short sessions every night, and we're gonna meet again tomorrow at 6, and we are going to end at 15 after. I started a little bit late today, but we're gonna end now. If anybody has a question on Instagram and we're finished, please just DM me, and I'm happy to answer your question. And thanks everybody for joining me. I really appreciate it. And just to reiterate, I did a radio show this morning on 102.6 thesituation.com, and they recorded it and they said they're going to post it on their website. So thanks for joining. Take care. I'll see you tomorrow, I hope. All right.